We're here in the city of Sayoun to provide medical relief and to share our experience with our Yemeni colleagues in Sayoun General Hospital. And this is the largest actually medical mission in Yemen for MedGlobal. We have 22 doctors and surgeons from 6 different countries, from the US, from Canada, from France, from Spain, Netherlands, and Russia. And we're here, of course, because of what's happening in Yemen, which is going through one of the worst humanitarian crises in our lifetime. More than 90% of the population in Yemen are in need for assistance. There's 50% of the physicians have left. And we work with and partner with local communities and local NGOs, local hospitals, to improve their capacity through training, education, and donations of technology and medical supplies.
I have traveled before. I volunteered with MedGlobal in Bangladesh last year, and when I heard that they're planning a mission and they're hiring volunteers for a mission to Yemen, I applied straight away because I always wanted to come and help since the crisis started in Yemen. I've heard about the conflict and I've never practiced in conflict zone before, so that was one of my objectives. I am really hoping to make some difference over here.
Well, I heard about Yemen a long time ago when the war started, and I said it's something that I could do to help in Yemen. But then it's not a country that you could go to very easily when the country is at war. And so when MedGlobal sent me an email and said, would you like to go to Yemen? I just jumped on it. I said, sure, I would like to go to Yemen to help out. I wanted to do something like that, like Dr. Tom Dooley in Vietnam and Dr. Albert Schweitzer in Africa. My children are grown now, and I could afford to go away, leave my job, and go to do work like that. So the past 13 years, I actually left my job as a professor of medicine in the university, in a medical school, and then I have spent part of my time just go around the world helping out in disaster response and to do humanitarian work in refugee camps.
The seriousness of the situation here, Yemen is one of the poorest countries in the world even before they had a civil war. Their infrastructure is collapsing very quickly, so any part of help that I could be of, whatever little it is, I'm happy to do.
Well, I've been involved in surgical missions for quite some time. I go to different countries and offer my services where they're really needed. And so this is my way of giving back to the world.
I have just finished my operation, DDDH, a child 2 years with central dislocation of the hip. I'm coming to the Yemen with MedGlobal to help Yemeni people.
Currently one is...
That's what I mean. When
one's gone, so
yes.
we'll bring him out here.
When he's gone, we'll clean up the high acuity room for you.
That's right, perfect.
I think that it's incredible amount of expertise that we brought here. I hope that the local, not just the patient, but the local doctors, nurses and healthcare professionals in general have been able to take some of our ideas. Yes, we are in the middle of a dangerous place, it's a conflict zone, and I don't think that any of us are here for the adventure, but because we and I have got a strong desire to actually bring your skills to where they're needed. I think that I consider myself extremely fortunate, and I've always thought that, that there was time for me to put back.
I've been seeing 50, 60 patients a day, sometimes more. We brought a really nice technology, a bedside ultrasound on an iPad. I trained already several physicians. I trained them how to deal with diabetic. I did lectures on this, and I talked to them how to do ultrasound at bedside. Hopefully tomorrow I'm doing around 10 biopsies So I can train doctors how to do it, because a lot of these people, they can have thyroid cancer and they could be missed or untreated till something wrong has happened.
How can I do something where I can bridge the gap between cancer treatment in a third world country with cancer treatment in superpower countries and so forth? And that's what motivated me to come to Yemen and other poor countries where I've been to Sierra Leone, I've been to Lebanon, I've been to Gaza as well, to see what I can do to help the community there, and especially the surgeons, in terms of providing them the best cancer treatment.
There's 2 million, 3 million people in this area, and there's not a single endocrinologist in the area, unfortunately. So they have to travel 8 hours in a war zone to see an endocrinologist in another city.
We have a couple of portable ultrasounds that we've been donating. We had 10 in total that are being donated here in Yemen. It's a really cool tool, but people need to know how to use it. So that's where I come in, is just to do some of the trainings and teach people. I taught them a little bit, and then they started teaching each other, which is just exactly what you want.
So here I'm teaching Helping Babies Breathe, which is a newborn resuscitation program for resource-limited settings. And we teach it in the train the trainer model, so that I will have taught some of these students to be teachers, and today they're going to be teaching it to other students. And in that way, there will be sustainable education in Yemen.
Also, we are trying to maintain a long-term connection, long-term commitments with them, so that the center can get stabilized and serve these people effectively and treat the cancer effectively and have better results and better outcome.
And the more you do, the more you help people, the better you feel. And the less money you earn from this, the more money you spend on this, the better you feel. There's something doesn't add up, but believe me, it does make sense, and it just feels good. I ask every doctor on this mission, and that's exactly their answer. It does make me feel better.
I have been selfish and serving myself for a long time. Now I thought it's time for me to help others, and it's a great feeling, much better than what I make money out of my profession.
We live in areas and countries where everything is easily accessible, and I think we take all this for granted. And in order for me on a personal level to feel the blessings that we have, I think it's important to value them. I think it's important that when I travel to do this humanitarian mission in areas where they lack these healthcare access, food, water, whatever it is, when I come back home, I get to feel these values and these blessings that I have back home.
It's obviously, medicine is worldwide. The human body is the same everywhere. So the skills that I've learned can be used, in all these different situations. And yeah, that's kind of my motivation, I guess. Before I went to med school, I worked with the homeless. I worked with prisoners. It's what is just sort of an innate part of me. I don't know exactly why that happened. I think, partly just being an immigrant from Iran and knowing that my parents had sacrificed a lot, I think that always made me feel like I needed to help other people.
I've been doing that for 50 years. The motivation is to try to save lives.
In general, the mission was very successful. Our Yemeni colleagues benefited a lot, and we also benefited from their experience and skills.
The team was very good, with very good specialists in many disciplines. And as I was used to work alone, it was quite interesting to confront different modern technologies for treating people.
What unites us is our sense of duty and our love of humanity, and the fact that we believe that a child in Yemen or child in Syria or child in Chicago or in France have the same right of having access to dignified health care.
حياة احكي ولا تستحي يا عمر كحيان والله ما يمتحي اللي انكتب على الجبين والله ما يمتحي اللي انكتب على الجبين ليلة انت معي وانا وقلبي معك ليلة انت معي وانا وقلبي معك يا وديا يا معي يا كل شامي ودي يا وديا يا معي يا كل شامي ودي.
Abdomen looks good. So do we need to do ultrasound? You'll see. It's mangled. You're taking a picture. Inshallah.
معاك في كل شيء كن مطمئن للانتشار معاك في كل شيء كن مطمئن للانتشار وامشي وانا بمشي لو فوق ذلك السكين امشي وانا بمشي لو فوق ذلك السكين ليلة